Hello, I'm Dr. Thomas Schuler, Chairman of the Medical and Scientific Board of the National Spine Health Foundation. We're interviewing the top spine specialists around the nation to find out what you can do to overcome your back problem or your neck problem. I'd like to welcome you to Spine Talk Cities 2020. So with the innovation that we're seeing, sometimes we innovate out in front of insurance payments. And so what do you say about if a service or product is not covered by insurance because they call it, quote, experimental? How do you tell a patient to address that?
If the physician and the patient really believe that a particular technique or approach is going to be the best for them in the short and long term, then it's worth a conversation with payers. Now, at the end of the day, when a peer-to-peer happens, so when a physician talks to a payer, it may or may not be successful, but at the end of the day, we're only as strong as that conversation and what the payer is ultimately going to decide, and we just don't have overriding capability, and so it really, the financial implications become borne out by the patient, which is not necessarily fair. But I think there's some things that can be done as long as it's the right thing for the patient. The doctors can go the extra mile and talk to the insurance companies and present a cogent case of why a particular approach is necessary to a particular patient.
First of all, it's the squeaky wheel. You have to complain to the insurance, and oftentimes I will write a letter of medical necessity for them. And I go through a letter. We sort of have a form now that says, look, this is a 29-year-old. He's had 3 previous discectomies. If you do a fusion on him, he has this chance of getting, and I go through all the reasons why he should have a certain operation. And the other thing that is helpful, sometimes the insurance that they have, depending on the company they work for, the company may be self-insured, which means that they might have Blue Cross Blue Shield, but the insurance company, for example, may only be the administrator. And then you can take it to the HR folks of the particular company and get it overridden. So we tell them to be the squeaky wheel. We'll write the letters. If they're self-insured, we have a good chance of getting the surgery approved, because if you just have to convince the HR folks that this employee's best option is for this operation. And the other thing, sometimes it is absolutely ridiculous. Like recently, I had a patient that was told, I think a cervical disc was experimental, disc replacement that is. And I said, that is absolutely ridiculous. I said, you need to call them up right now. You need to call your senator or your representative. You need to write a letter to the insurance commissioner, and you can tell the insurance company you're doing that, and I assure you that they will approve it. So that's some of our strategy. It's frustrating. And then sometimes they just won't pay for it, and then the patient gets stuck paying out of pocket. And a lot of them can, and a lot of them can't. And then they have to decide if that's what they want to do.
My goodness, if something's good enough to get FDA approval, which you and I both know is a pretty high hurdle, the highest hurdle in the world, it should be good enough for an insurance company to pay for the patient. That to me is the most irking thing, that the patient's paid money to be able to get care and then can't get it. So the advice is really advocate. Insurance companies may not listen to a doctor, but they will listen to their insured. And if they make enough noise to the insurance company, they can get approval for something.
If the government decides that somebody over 65 shouldn't get a treatment paid for, a lot of times insurance companies follow that, and that's a 20-year-old that would be fantastic for that procedure. So I think it's going to get worse. And I think the way to go around it is to find centers that are pushing the envelope, right? And have a discussion with them, right? So sit down and talk through the risk benefits and what the alternatives to treatment are and what the benefit of this new uncovered treatment is. And so, I don't think everybody should jump on the train to do a lot of procedures where there's not great evidence. But if there's good evidence and there's good results, but insurance doesn't cover it, I think there's creative ways that patients could all figure out, or we could help deliver this type of care to those patients.
Just because it is not FDA approved does not mean it's not experimental. And so we've gone to the insurance companies and really pushed very hard to get many of these technologies, which they thought were fringe technologies, but they're not. They're actually tried and true technologies that we use all the time. So for the most part, with really good dialogue with insurance companies, you can educate them and you can get things covered. Now, there are still cases that they're completely resistant on. And then for those people that have the financial means, we have a way of, providing that care at a discounted rate in comparison to, paying 100% out of pocket. But in my center, that is not very common. But I know other surgeons around the country are doing surgery or procedures that are not covered, but still they truly believe in. And if the patients have the resource, that's absolutely their right to be able to do that. And the insurance companies or no one can say you don't have the right to do that.
Please consider giving to the foundation to help support this education and to carry this message of hope to all of those across America.
Spine Talks is a program produced by the National Spine Health Foundation. For more information or to make a donation, visit spinehealth.org.